This is the first of hopefully many videos that are geared towards my patients being educated, understanding the things we talk about in the office, and the things that I believe are important. So everybody has seen the checklist. I had my two colleagues, partners in crime for this project behind me. I have Matthew over there, and I have AJ over there. These are the guys, the brains behind the operation. They're going to help me produce what I hope to be short videos pertinent to what we talk about in the office, other things you may be interested in, whether it's preventive medicine, what your lab tests show and what you should look at them for, how you should interact with other doctors, and of course my philosophy of cellular aging, biological aging as the key to not only a long life, but a healthy life, a functional life, and a disease-free life. So I'm going to let these guys go over there, and we're going to talk really quickly on the checklist, because I know anybody that's been in my office is somewhat familiar with it, because I have this sitting next to my desk, and I believe it's extremely important as a generalized way to look at how you can control, in large part, statistically, based on a lot of science, including the Nobel Prize specifically of 2009. You can look that up. That was the Nobel Prize was won for something called telomeres, which have become known as our aging clock. Anyway, those lifestyle habits that are listed there, the first three in order of importance, are the key to staying healthy, aging slowly, which translates into less diseases. So, number one, exercise is going to be called the fountain of youth. If you ask any bench research scientists, they will tell you that there is a fountain of youth. It's not located in Florida. It is exercise, vigorous exercise. I'll give you one quick example. 5 days a week of exercise decreases a woman's breast cancer rate and man's prostate cancer rate drastically. Exercise has been shown to decrease aging probably better than any lifestyle habit, including fasting or the type of diet. Number two, stress, mind, body, all that. That's not the stress that we have on a daily basis that get the job done at work. Sometimes we do have more stresses. Those stresses actually can build up a body's tolerance simply because, as Nietzsche said, if it doesn't kill you, it makes you stronger. The stresses that were studied for the Nobel Prize were the stresses that hopefully very few of us experience. That is severe depression, ill children, abusive relationships, poverty. When they studied people who had these, they were aging 3 to 4 times faster on a cellular level, and it was cured easily by having people do mind-body exercises such as yoga, Tai Chi, other forms of breathing. The third of the variables which I like to focus on is going to be the diet. It's not just what we eat, it's when we eat. And actually how much we eat has become less important, always depending on what your particular needs are. But the what and the when are something that, as you know, I focus on greatly. 2 meals is better than 3, 1 meal better than 2, less carbs is better than more, etc. The other things you see on that list are things that are specific to a person, but everybody needs certain supplementation. Everybody needs social interaction. Again, these all come from Nobel Prize. Elimination is not just what we think of when we're eliminating in the bathroom, but it's sweat, it's breathing deeply and evacuating all the toxins that accumulate in our lungs, especially in the lower portion of our lungs. Obviously it is going to the bathroom, but anything that comes out is basically coming out with a lot of toxins in it, poison, so the more of that, the better. Sleep, I've never understood how important sleep was until I studied it. I read a book called Why We Sleep, which opened my eyes up to my personal need, and over the last several years I've worked on getting my sleep back to where my brain and my body are going to age slowly. My mitochondria are going to be optimized because your sleep will also regulate your hormones, which then allow you to regulate how much body fat you burn versus other calories. And of course, we now know that obesity and just adipose tissue in and of itself are risk factors for diseases. And the BMI, body mass index, which is a more accurate way of weighing a person, has now been determined as a predictor not only of disease, but also of longevity and functionality. So this is just an overview. This is going to be informal. This whole channel is only for my patients to try to reiterate or repeat the things that we talk about in the office that sometimes I don't have time to really have you understand. So I hope you enjoy it. I'm obviously going to take your advice and criticism, as well as if there's any topics that you would like to hear. We're going to keep each of these videos to around the 5-minute mark, and look forward to interacting with you and seeing you in the office. Bye.